The FDA has fired a warning shot at one of America's most beloved brands. They accuse the makers of Cheerios of selling the cereal as a drug to prevent and treat high cholesterol. It's a charge with a potentially huge impact on Cheerios' sales and reputation. We talked to Cheerios eaters to find out why they ate Cheerios, the importance of the health claims, and their reaction to the charges. First, we asked who eats Cheerios and why.
We buy them to eat ourselves, and we buy them for our kids, and we buy them for our grandkids.
I buy it mostly for my 2 kids.
They're good for your health, good for your cholesterol, so that does play a factor.
It's healthy, it's vitamin rich.
You tend to get more fiber, more vitamins. There's probably some holdover from having them as a kid that just makes you like it more.
I've been eating Cheerios since I was a little kid. I really don't look at the health on good or bad. I just know I enjoy it and my kids enjoy it, so I like my Cheerios.
Next, we wanted to know if people saw Cheerios as a treatment or preventative measure for high cholesterol.
I personally actually have naturally high cholesterol, so I do eat oat products and I include Cheerios. I don't rely on Cheerios exclusively to lower my cholesterol. It doesn't happen that way.
Well, I guess if you consider that you could either eat eggs or you can have Cheerios, Cheerios makes the most sense because there's less of all the negatives in it.
Most people felt the FDA charges were a little off base.
I've heard they help your cholesterol go down, although I always kind of thought that was because hopefully you then wouldn't be eating things that would make your cholesterol go up.
No, not a drug or a treatment at all.
I see it as a potential benefit of eating the food. I don't look at it as medicine, it's food.
The charges are unlikely to change people's opinion of Cheerios.
I'd probably think it was the FDA being hypersensitive.
As long as there's nothing in the product that's going to harm my family, why would I stop using it?
It's absolutely the opposite of a drug. It's a natural product that has a tendency to lower cholesterol, but it's anything but a drug. So I would buy it all the more for that reason.
I don't see any reason. I mean, I'm 51 years old. I've had Cheerios at least for 49 years that I know of, and I feel relatively healthy, so I don't think they would work against me.
The FDA whining isn't going to make me stop buying my Honey Nut Cheerios.
The FDA charges could cost Cheerios, but not in terms of damaged brand reputation. And people truly do trust Cheerios, perhaps more than the FDA.